Emily, you're about to see Natalie. What can you tell me about her?
So Natalie is a 30-year-old female. She's been referred to us by the midwife to the outpatient physiotherapy. She's 30 weeks pregnant now. She has anemia and gestational hypertension. Her referral also says she's had lower back pain since her second pregnancy, and this is her third pregnancy, so it's gotten a lot worse during this one.
Okay, and do you know what gestational hypertension is?
Yes, well, it means she's got high blood pressure during pregnancy, but I'm not sure if it has any impact on what we're going to be doing today, but I can look it up.
Yeah, that sounds like a really good idea. Anything else you want to tell me?
Yes, the referral said that she was working, but it didn't say what she was doing, so I really want to ask her about that. She's also taking Ferrograd C, which is an iron tablet, and Elevit.
Okay. And with those medications, do you know what they are or what could impact on your treatment today?
Well, I know that the Ferrograd C iron tablet helps with the anemia. I'm not sure what Elevit's for.
Okay, so you are correct about the iron tablets. Do you know anything about their side effects at all?
No, not really, but I can look it up.
Good, good. And what about her social history?
It doesn't really say much else, except she's gravity 3 and parity 2, which tells me she's had 2 children.
Okay, that's great. And I think you have a few things to look into now. Gestational hypertension, the effects of iron tablets, and what Elevit is. Do you want to look into that now and we'll get together again a little bit later?
Yeah, sure.
So what did you find out, Emily?
I found out that gestational hypertension is a sustained high blood pressure reading over or equal to 140/90 during pregnancy after 20 weeks gestation in someone who's previously had normal blood pressure. It doesn't have proteinuria or other symptoms that may suggest preeclampsia. I was able to find out that it's usually managed with regular monitoring and lifestyle changes, and in some cases also medication helps, and will usually result in a routine induction of labour, ideally from 37 weeks, but sometimes maybe earlier in really severe cases. I checked the referral again, and it does say that she's planned for a C-section at 37 weeks. Also found out that iron tablets could cause abdominal pain and nausea, vomiting, constipation, diarrhea, black discoloration of feces, so I should probably ask if she's had any of those side effects. And Elevit wasn't in the Australian Medicine's handbook, but it was in MIMS, and it's a pregnancy supplement.
Great. So what do you want to do today?
I want to check her medical history today and any other medications which aren't on the referral. I want to find about her pain, where it is, if it aggravates it, what makes it better or worse, and any special questions like pins and needles, any numbness, weakness or heaviness, cord or echina. Doesn't say anything about social situation or the work, so I'll ask her about that as well.
Okay, is there anything specific you want to ask her about her social situation?
I want to know more about her children, her birthing history. It could have something to do with her current one. It doesn't say much about her back pain after the birth of her second child, so more about that.
And what do you plan on assessing objectively?
I guess that would depend on Natalie, but I do want to check her posture. I want to check her gait, palpation around where the pain is, and check her lumbar range of motion as well.
Okay.
I guess any neurological assessments, if she's had any neurological symptoms, and I want to clear the thoracic spine, SIJ, and hips.
Okay, and what about some specific lumbopelvic tests? Which ones are you going to look at?
We do a standing forward flexion test, and the test where they stand on one leg bending over the I forgot what it's called. I could do the posterior pelvic provocation test, distraction and compression of SIJs as well.
Great. Anything else you can think of?
The active straight leg test too.
Yeah, great. What time are you seeing her?
So Natalie's appointment's at 10:30.
All right.
Hi Natalie, I'm Emily and I'm a final year physiotherapy student. This is my educator Anna.
Hi Natalie.
Hi, how are you doing?
So you've come in today because you've been referred by your midwife for some back pain, is that right?
Yeah, that's right. I was telling my midwife my back's been getting really sore and it's getting a bit difficult to work, but hopefully I can work until 35 weeks.
Okay.
Yeah.
Can you tell me where exactly your pain is that you feel it?
Yeah, it's just up here. It's just
Yeah. And would you describe that as a sharp pain?
it's like a painful deep ache.
More like a deep ache.
Yeah.
Okay. If you were to rate your pain out of a 0 to a 10, so 0 is no pain at all and 10 being the worst, what would your pain be at the moment?
Right now, about a 2 out of 10.
About a 2? Yeah. Awesome. And what would you say your worst pain has ever been? What would you rate that?
Probably about a 7.
7. Okay. And at its best, what would you say?
Sometimes I have no pain.
Okay, that's good. Yeah. And can you tell me if you know, like, when it started for you?
Well, I had it after I had my son. He was a cesarean. They were both cesareans. But it got better, and then it got worse again with this pregnancy.
Okay.
I think around about 20 weeks. Yeah, when I had my 20-week scan.
20 weeks. Okay. And what do you think brings on the pain more?
Usually if I've been like standing a lot or taking, walking up and down a lot of stairs,
Yeah.
when I'm sitting for too long as well,
Okay.
getting in and out of the car.
Uh-huh. And can you tell me what would relieve the pain for you?
Rest, a hot shower, a hot pack,
Mm-hmm.
clean up.
Okay. Would you be able to walk me through your day? So how your pain is in the morning compared to how it is in the evening?
Yeah. In the morning, it feels quite stiff, and then when I get out of bed and when I stand up, there's usually like a catching pain, and it's quite uncomfortable. And then during the day, it tends to sort of get worse. Usually by the evening, it's quite sore.
Okay. So
Especially on days that I've been at work.
Oh, okay. Yeah. So, going back to the night, do you wake up at all during the night?
Yeah, and sometimes it's hard to find a comfortable position, and I'll wake up 2 or 3 times, usually with it when I'm rolling over. Or
Okay. Do you get any pins and needles, any numbness, weakness, or does it feel heavy in your legs?
No, not really heavy, just tired.
Okay. And what about the position you're sitting on, like on the bottom? Does it ever hurt or get sore on the pelvic floor area?
No, I don't
No?
think so.
Okay.
Really.
And do you feel any different when you like going to the toilet?
No.
You feel any difficulty going to the bathroom when you're weeing, or like bowel movement? Are you having any difficulties with that?
No, I feel like I'm going all the time to do a wee. Sometimes I'm a bit constipated, which didn't really happen with my other 2 pregnancies.
Okay, yeah, so going to the bathroom is quite common with your pregnancies, of course, because while the baby's growing, it's pushing down, so you don't have much room. Because your bladder is being pressured quite a lot. So also want to ask if you ever have any, if you're ever scared that when you sneeze or cough that you might urinate?
Like have an accident?
Yeah.
No, it's
No.
never happened to me. I know it's pretty common actually, but
Yeah.
I've been lucky.
Okay, that's good. That's good. You've also mentioned that you've been feeling a little bit constipated. Do you have any other medical issues such as breathing problems? Do you have any thyroid issues or epilepsy, blood pressure, any diabetes, arthritis, or any infections or illnesses in the past?
Well, I'm anemic, so I've got anemia, and my blood pressure's been high. It was high with my other pregnancies as well.
Okay. Yeah. Are you on any other medications?
Just the iron tablets, the Theragrid C, and the Elevit.
So just those two. Yeah. How are you going? You okay with your back? You're not feeling any pain at the moment?
Oh, just a little bit. It's okay. Thanks for asking.
And let me know if anything happens. We can find a better position for you to sit. Okay.
Thank you.
So you did mention you have 2 kids currently. Were they vaginal birth or cesareans?
Both cesareans, yeah.
Okay.
So emergency cesarean with my first, and then an elective cesarean with the second.
Okay. And how old are they now?
Zoe's 4 and Noah's 18 months.
Oh, lovely. That's nice. Is there anyone else at home as well?
Yeah, my partner James.
Okay.
Yeah, he's very supportive. Helps a lot with the kids. But sometimes I still have to lift and carry around Noah.
Okay.
Yeah, which is a bit difficult.
You also mentioned that you're still working.
Yeah, that's right.
Yeah. And what do you do for work?
I just work at I'm on the checkouts, and sometimes I do grocery as well.
Okay, so you're on your feet a lot.
Yeah.
Okay.
Yeah.
Okay.
Yeah.
All right. So from what you're telling me, it sounds like the pain may be coming from your pelvis and not so much your lower back. But to confirm this, I'd like to do some assessments for your back and your pelvis, and if that's okay with you, so I can work out how we can help you.
Yeah, sure.
Okay, Natalie, I'm just going to place my hands on your back here, and I want you to shift your weight on your left leg and lift up your right knee. Right, I'm just going to put it there. Can I get you to do that again? Yeah. And now shift your weight to your right and lift up your left. Okay, how's that?
Oh, a bit sore there.
Sore? Okay. Just where you're pointing now, is that where it's sore?
Yeah.
Okay,
Yeah.
around there. Okay, that's all right. Okay, I'm just going to pop your shirt back down because I'll get you to lie on the plinth now. Okay, so we'll get you to sit down first. I'm just going to pop the bed out. Okay, so I'll get you to lie down on your back. Yeah, try to go down carefully so you're not going straight back. Yeah, to try to give yourself a little bit more support so you're not hurting your back.
What do you mean?
Oh, yeah, just bend down a little bit. Yeah. Okay. Alright, comfortable there? Is that too high?
A little.
A little? Okay. That one. Okay.
Yeah, that's better. Thank you.
Okay. Okay, Natalie, I'll just get you to pop your legs out straight for now, if that's okay. I won't keep you here for too long. So I will first get you to lift your left leg up and try to reach my hand.
It's just a little bit high, just a little bit lower there.
Lower?
Natalie.
Okay.
Yeah, that's better.
We'll do that again. How was that?
That's okay.
That's okay? Okay. I'm just going to do the same on the right side, and you let me know how that is. So we'll just up there.
Yeah.
Okay, so we'll try that one. Okay, so you didn't. How was that one?
It's a bit painful.
A bit painful. Okay. How would you rate that out of a 10?
Oh, about a 4.
A 4. Okay. Okay. We'll try. So I'm going to put some pressure here just to see if we can stabilize that a little bit and see if that makes a difference in your pelvis. Okay. So I'm just going to compress a little bit there, And we'll try to lift the right leg up again a little bit. Yeah, how was that? Is that better?
It was a little bit better, yeah.
Emily, just come down a little bit further.
Down?
Yeah, just to be able to stabilise a little bit more.
Sure. Okay, so we'll do this again.
Okay. Just coming down just a little bit more. That's better.
Okay, so we'll try that again. Lift your leg up for me. Okay, that's good. How was that?
Yeah, that felt easier actually, and not as painful.
Give that a number out of 10?
Oh, about a 2.
About a 2. Okay. Okay, that's good. Alright, so I'm just going to go back to your left side. And I'm going to put some pressure on your legs. So I'll lift your left leg up there. And I'm just going to, you right there?
Yeah.
Okay. I'm going to roll you over so I can put my hand underneath and put some pressure on there. Alright, how does that feel?
That's okay.
That's okay? Okay. Down there. And I'll do the same on the other side. Okay, so just lifting this one. Okay. Roll you over again. And put a little bit of pressure there. You don't like that?
Yeah, that really hurts.
Okay.
Yeah.
Can you put a number on that one?
Oh, that's like a 7. That's like the pain I get when I'm standing for too long.
Okay. Right, a 7. Alright, so I'll put that down.
Okay, Emily, what did you find out about your assessment?
So Natalie was reporting an intermittent deep ache through her right lower back and SIJ. It's aggravated by standing, climbing stairs, and carrying her son, and reports ache through her right lower back when sitting as well. It can improve when she rocks her pelvis. She massages her bottom as well, and hot showers and hot packs. She usually feels stiff in the morning, which can settle after moving a little bit, and she finds her pain is usually worse over the day if she's been on her feet all day. She's working at on checkouts, so she has to be standing for work, and she lives with her husband. She has a 4-year-old daughter and 18-month son. She mentioned she also has constipation, which is new for her in this pregnancy.
Okay, Emily, so do you remember anything specifically that Natalie did with her youngest child?
Yes, she mentioned that she carries him around sometimes, yeah.
Absolutely. Do you know how she is carrying her son and how much he weighs?
No, I forgot to ask, but I think I'll ask her the next time I go in.
That's good. That sounds like a good idea. But to help with your planning, how do you see a lot of mums carrying their toddler?
I know they tend to carry them on one side, on their hips.
Now, what did you find on your objective assessment?
Yes, so in standing, she has an increased lumbar lordosis, and she was tender on palpation through the right PSIS. She had reduced range through flexion, no pain, and slight pain on the right with the right lateral flexion. But she did have pain through her right buttock after stepping onto her right leg. She had a positive, the one when she goes up to one leg, positive P4 test, and and positive active straight leg raise with right leg raise with improved control with compression and improved pain through right glutes with TRA activation. She was also tender on palpation through her piriformis and glutes as well.
And can you remember what the name of that special test is, where you're standing on one leg and then you flex the non-stance hip?
Yes. So Gillette's or the stalk test.
Okay, and so what would your diagnosis be?
Well, I think she has more movement through her right SIJ, and I think this is aggravated by a lot of standing and putting weight onto her right side.
Okay, so what would your treatment plan be?
Well, I want to give her education about why this may have occurred because of the hormonal changes related to with the relaxin and during her pregnancy, and relate this to her symptoms. I also thought we might be able to do some massage through QL, piriformis and glutes, and maybe teach her some self-massage, piriformis, stretch, and then the compression seemed to help, so I want to try a pelvic belt on her as well.
Okay, and what about her posture? Is there anything you want to discuss with her about that?
Okay, well, I've already provided some advice getting in and out of bed, but I would like to give some advice about reducing load unilaterally, particularly with work and lifting and back care for work, and also while she's lifting a toddler as well.
Great. All right, let's go back in.
Alright, Natalie, so last thing we're going to do is put this belt around you. So it's just going to come around here. It's going to be similar to how I placed my hands around your pelvis to support that. Did that help you before?
Yeah,
Yeah.
felt good.
So it's similar to that. It's just going to support your pelvis, so when you're moving around, it helps support that better. So I'll just get you to stand up for me. So I'll put this around. So I'm just going to place it around here. Alright. So just going to pull it around and okay, how does that feel there?
Yeah, that feels
Good. Okay. Okay, so we also have these two straps on the side. So I'm just going to get rid of these. So what we're going to do with these, I'm just going to pull a bit firmly but not too hard. So I'm going to put equal amount of pressure, and just going to brace yourself while I do that. Okay, so just doing that. Okay, how does that feel? So not too tight, but it
No,
provides
that's
some
comfortable.
support. So I just want to check with that, like the exercise we did before when you raised your left knee up. Just want to check how that feels for you. Okay. Does that feel better?
Yeah, it feels better than before.
Different than before? Okay.
Yeah.
That's good. So we want to get you to wear that while you're working, when you're on your feet, and also we'll try to get you to put it on yourself as well. So we'll take this off, and I'll get you to put this on yourself as well. So just so you have some practice, I'll get you to put it on yourself. Just around this. Yep, just a little bit lower, that's good. Yeah, and you just want to make sure that it's centered and make sure it feels just under the abdomen. Okay. Yeah. And you're just going to pull both of those together. Just firmly but not too tight. Good. How does that feel for you?
Yeah, it's a nice comfortable squish.
Alright, awesome. So yeah, so try to wear that while you're standing, on your feet, when you're working. It can readjust when you sit down, so make sure if it falls loose or anything, just take it off and redo it again. And yeah, hopefully that works out well for you.